Hello, my name is Kelly Schmidt. I'm your course instructor for D439 Foundations of Nursing. Welcome to a quick overview on Chapter 18, Planning, the planning stage of the nursing process. The planning phase of the nursing process is the stage where nursing care plans that outline goals and outcomes are created. The goals and outcomes formulated during this phase directly impact patient care and are based on evidence-based nursing practice. The planning step is where you decide how you will help the patient reach the goals. The planning step is all about what you will do as the nurse. The planning phase of the nursing process is essential in promoting high-quality patient care. It is considered the framework upon which scientific nursing practice is based. Care planning for the patient provides direction for personalized patient care based on the client's unique needs. The planning phase enhances communication between patients and nurses and other members of the healthcare team. And planning encourages continuity of care across the healthcare continuum and promotes positive patient outcomes. Some of the questions you can ask yourself is, what's the game plan? How are we going to help the patient meet their goals? What interventions do we need to help the patient meet their goals? Who needs to be involved? Do we need someone from physical therapy? Do we need someone from nutrition? What resources do I need? And do I need a doctor's order for any of the plans and the goals that we have selected? Planning is essential in promoting the delivery of competent nursing care. We need to focus on nursing interventions that will promote positive patient outcomes. The first thing we need to do as nurses is establish a priority. The nurse reviews the nursing diagnoses and prioritizes them according to physiological and psychological importance. We need to organize the patient's nursing diagnoses into a format that promotes effective planning. We need to develop SMART goals. This objective of the planning phase of the nursing process involves setting goals related to each diagnosis. Goal setting helps provide guidelines for nursing interventions and establishes criteria by which the care plan's effectiveness is evaluated. A SMART goal is specific, measurable, relevant, and time-bound. We need to establish expected outcomes. After the goals are established, we can identify expected outcomes based on each specific goal. The outcomes need to be realistic, mutually desired by the patient and the nurse, and obtainable in a designated amount of time. SMART goals. What nursing interventions do we need? Remember, these interventions are prioritized based on the order of planned implementation. We then need to document. Documentation not only includes the nursing orders, but they will be well written and should include the order date, which action will be performed. There needs to be a detailed description, the time frame in which the intervention will be performed, and the nurse's signature. These nursing orders are important in communicating with other members of the nursing team. Nurses must have strong communication skills in the planning phase. Our time management and organizational skills must also be impeccable. And we need to have a willingness to work collaboratively with patients and their families or their caregivers and the entire interdisciplinary team. Nurses must have strong critical thinking skills and must weigh the risks and consequences of each intervention. The planning phase of the nursing process is when nurses formulate goals and outcomes that impact patient care. This step involves prioritizing patients' needs, identifying expected outcomes, establishing nursing interventions, and identifying patient-centered goals. Nurses identify goals and outcomes based on evidence-based practice guidelines. There are challenges. There are different formats for creating care plans. We should be familiar with how our facility uses their care plans or what format they use. Electronic health records has made it easier to choose nursing diagnoses and interventions and creating care plans. But if we don't establish goals and expected outcomes, no plan is complete without clear goals and outcome identification. If there are no goals or an insufficient number of goals relevant to the nursing diagnosis, or deciding which intervention is needed, we may become stuck. Because nurses use a roadmap called a care plan that all members of the nursing team use to help the patient reach their goals. It is vital that the nurse establishes goals that are attainable and relative to the patient's needs. In this phase, the nurses should establish short-term and long-term goals and determine the outcome associated with achieving these goals. Establishing goals and outcomes is vital to this step in the nursing process. Nurses need to take their time to consider each goal and outcome carefully and discuss the plan with the patient and the healthcare team. If we fail at this, we will not be able to establish goals that are attainable. We won't be able to select which interventions are possible for this patient. Goals should be tailored to meet each patient's needs and should be considerate of the patient's cultural beliefs and values. Setting unrealistic goals. It's really great to be optimistic about a patient's ability to achieve a goal, but it's essential for nurses to be realistic about what their patients can or cannot do. If a goal is unrealistic, patients can become easily frustrated, and frustration leads to noncompliance, which can negatively impact and affect patient outcomes. As nurses, we must determine which goals the patient can achieve realistically. Realistic goals are specific and well-defined. They're measurable, they're achievable, and they're relevant to the patient's status and needs. They also need to be achievable in a specific time frame. We should discuss goals with patients, family, care providers, and even our nurse manager. We need to offer support and encouragement to the patient. As nurses, we should continually monitor and assess the patient's progress towards meeting goals. We should never limit patient input. Nurses can create nursing care plans independent of patients' input. But excluding patients from plans about their care may lead to distrust or confusion. If a patient feels he cannot communicate with nurses or his opinion is not valued, it can result in noncompliance with the care plan and negatively affect the patient's outcome. We can overcome this challenge of limited patient output by promoting a comfortable and trusting nurse-patient relationship, which encourages patient participation. We should ask the patient about their health goals and what limits they feel may affect their ability to reach goals. We should offer suggestions about desired goals and expected outcomes and explain why they are relevant to the patient's health and long-term well-being. Patients need to be involved in their care. When discussing the care plan with the patient, it is important to explain each goal to the patient. And we cannot set unrealistic timeframes in which the patient is expected to meet these goals. At times, nurses fail to plan care based on the individual patient's abilities. Instead, they establish the goal based on their perception of what the patients with same diagnoses may be capable of achieving. Everyone is different. We need to consider that patients are individuals with specific goals and abilities, and the nurse should specify a time frame for achieving goals that is reasonable, and it does not create stress or worry for the patient. What is a care plan? A care plan contains relevant information about a patient's diagnosis, the goals of treatment, the specific nursing orders, and an evaluation plan. Over the course of the patient's stay, the plan is updated with any changes and new information as it presents itself. Most hospitals require nurses to update the care plan during and after each shift. Nursing care plans define nursing guidelines and some treatment guidelines for a specific patient. The roadmap, the care plan. It is a plan of action. It helps guide nurses throughout their shift in caring for the patient. And it also allows nurses to provide attentive and focused care. Nurses need to assess the client by reviewing all relevant data, medical history, vital signs, assessment, emotional, spiritual, psychosocial needs. And identifying the nursing diagnosis. We need to set goals in our care plan. These need to be desired outcomes and measurable by which the patient will achieve. It is ideal to set goals with the patient when they are able. Not all situations like this are possible. We need to implement nursing interventions. They are actions taken by the nurse to help patients achieve goals and meet desired outcomes. We need to include initiating a fall precaution, assessing pain levels, administering medications. And we need to evaluate the effectiveness of this plan. The plan can change or be updated as needed or indicated. A short-term goal in nursing care is a goal focused on demonstrating a change in behavior. A short-term goal needs to be completed in as little as a few minutes or up to a few days. Long-term goals are for an extended period of time, weeks, months, or years. A patient should be included in all phases of the nursing process because the patient is the best source of data. The person being treated and is usually the most reliable source of information used to determine the patient's strengths, weaknesses, and likelihood of compliance with a plan of care. When possible, the patient should be included. If you have any additional questions, would like some practice questions, etc., you know how to reach out, kelly.schmidt@wgu.edu. Thank you for joining me. I hope you have a great rest of your day.